Kona, when asked, 49% of the Kona region says that they have to go to another island for their medical treatment. 42% of the Hilo area say that they go to another island for medical treatment. So, in addition to what Hawaii is saying in general, there are pockets of extreme concern, and the Big Island is one of them.
I think what we're seeing is this this connection between several of the health issues we've discussed. We've spent a previous hour talking about the healthcare workforce, for instance, and fostering growth in the residency program to promote and educate more primary care physicians. But without those physicians, we don't have the ability to actually staff the long-term care facilities. And without the ability to staff the long-term care facilities, we don't have enough places to have people go. So the hospitals back up, the logjam problem that Dr. Shikuma described. So these all seem to be very intertwined. Would you agree?
I absolutely agree. Medicare rates for physicians is a serious problem. You've got and really, as Craig described, it's not just the relationship between the acute care hospitals and the system being congested there, inability to move patients to the next step. The whole system is congested, whether you're talking about nursing homes, which basically are unaffordable, care homes, which there may be pressures from within the care home community that might change the complexion of how many care homes and foster homes there actually will be out there, and say in 15 years.
Right.
Thirdly, the home care providers themselves are under severe pressure. I mean, I think we discussed earlier that in the case of, for example, in the case of the nonprofit providers, we had a meeting the other day with the nonprofit providers providing 11 services. 8 of those services are waitlisted. In other words, if somebody called today in that nonprofit category, they'd say you have to stand in line. Now, I can't speak for the for-profit side, and we're assembling data on that, but it's not a good situation.
Pam, I think why don't you give us your perspective from the nursing side to help complement what you've just heard, both from Stuart and Dr. Shikuma. What are we seeing as far as the ability to care for individuals as a nursing supervisor?
Well, I know that right now we are barely making it with the beds that we have. We know that there's a increasing baby boomer population, and we won't have enough beds to take care of them. But more than that, we need more home and community-based services. There are people in our nursing homes right now in Hawaii, on the Big Island especially, who really don't need to be in a nursing home, but there's not enough services in the community to support them in the community, and so therefore they're in a long-term care bed, which then a person who needs long-term care can't go into that bed, and so it again backs up the system. Right. I know that we need to increase those community-based services. It's very expensive to pay for a home care aide if you really needed it. So I know that right now we have a lot of needs in East Hawaii, especially.
You know, what I've heard consistently among the three of you is that as you look down the road, the need for these services gets greater and greater, right? As your demographics, the numbers, reveal. Yet the opportunity to access the services, whether on the basis of availability or on affordability, becomes more and more challenging. So, because this is a real concern, right? Some may say even, achieving crisis proportions. Craig, is there a starting point? As a practitioner, as a frontline person, are there starting points to begin to addressing, these needs perhaps more effectively?
Well, just an old country doctor. No, look upstream from the log jam in the emergency room. Are we giving the people? Are we giving everybody the care, preventive care they need? Do they have access to primary care doctors? Are they getting their blood pressure controlled? Is their diabetes being controlled? I mean, the patients that are coming in, let's face it, coming into the hospital, it's a little late for preventive care. I mean, they're already having the side effects, the vascular disease, the heart attacks, the strokes. Are we giving that kind of care where we're preventing people to get to that state? Are they controlling their cholesterol? Are they cutting down their cardiovascular risk? And I don't think it's being done. It's just a lack of access to care. We don't have enough providers. I mean, you know, everybody on the Hilo side, you know, physician-wise, I mean, they're full and they're backed up, and people are trying to. I have patients coming around that call my office and they're looking for a physician, primary care physician. And I said, how did you get my name? Now, 20 years ago, they used to say, oh, you know, my relatives referred you. You know, now they're saying, I'm going down the phone book. They don't even know who I am. And when you get down to S, that's kind of bad already. That means they've gone through the whole phone book, you know, for physicians. So, you know, from the physician side, it's just providers. I mean, we need more manpower. We need more woman power. We need more docs. You know, and I think some of these problems will be alleviated. It's not a whole solution, but you know, like the residency program, which is another, you know, pet of mine. You know, as far as an idea, you know, we got to bring primary care guys in. When the primary care guys come in, subspecialists will come in. You don't want to get in a position where you're losing doctors. The doctor population is going down, where more people are going off island to get their care, because the less you do on the island, the less docs you're going to have, which means the less you do, which means the less docs you know, and you don't want to be that way.
Yeah, it seems you're expressing a real key point, because in some of our previous discussions, the same concern, the challenge, having an adequate number of the professionals to help provide the needed services, you know, continues to be a critical factor. But Stuart, you know, I'm hearing from, you know, those who are on the front line, accessing services, and in a number of respects, you know, just having an available bed is a concern. Did the study that AARP, the study that you did, does it indicate or give us some sense in terms of if there is a shortage, you know, what is that shortage, and as we look down the road, you know, how big a problem does it become?
The study was mainly to probe for what was on people's minds, because that expression has been missing from the debate. And everything whether it's that study or previous studies or whatever I've seen, let me just give a graphic description of what you just described a few minutes ago. In my book, what you got and what you're going to have is a train wreck. You're going to have a train wreck, and it's only a matter of how big that train wreck is going to be. But you know, there's not enough in the system today, and there's probably not enough money in the system today to provide a 100% answer. So you know, this is not something that we can put a Band-Aid over and say let's go solve the next problem. You are going to have a train wreck. I mean, you may as well just get accustomed to that idea right now. Let me put in a plug for the Long Term Care Commission, because I'm on that commission, and you know, people might say, you know, another committee, what's going on? This is another study. I mean, if you were to put the studies that have been done on long-term care side by side, it'd probably reach the ceiling. One thing the drafters of the long-term care bill, Act 224, and they came from the Senate and the House, one thing they noticed was the group was not as inclusive as it should be. Labor is missing. Management is missing. There are parts of the community that touch on aspects of long-term care that are not evident today. For example, the management of the system. Right now, the long-term care establishment is divided among two executive departments, health and human services. Other states, they have